4 people are feared dead in different public hospitals around the country as the health workers' strike takes effect. In other parts of the country, many patients were left unattended to as medics kept off.
Well, in Bungoma, a security guard was forced to help a woman deliver as she made her way to the hospital. Ngoiri with the face of suffering on day 1 of the strike.
In the IC unit at the Kisii Level 6 hospital, a 15-year-old boy is fighting for his life. Alex Ogutu was brought here 2 weeks ago with lung complications. With the strike and no doctors and nurses to attend to him, and time slowly ticking away, his hopes of getting better are dwindling. He is just but a face of the crisis in public hospitals. In Bungoma County, a security guard at the Bungoma Referral Hospital was forced to play the role of a midwife when he helped a woman give birth on arrival at the hospital. None of the attendants was at the hospital at the time, and the few that were there refused to help for fear of repercussions. Rosabella Marani, age 32, had arrived at the hospital this morning with abdominal pains. The security guard moved in to help when she fell on the floor, frantically calling for help. Luckily, she delivered a baby boy. The empty halls at the Kiambu County Level 4 hospital are buzzed with steps. The wards are empty, and the largest and most important public medical facility in Kiambu County is at the epicenter of the most punishing strike. 2 patients are said to have lost their lives at the facility after doctors and nurses downed their tools. A scenario that is replicated at the Meru Referral Hospital, Ward number 3. 2 patients in critical condition lost their lives as they waited to be attended to. Another lady gave birth at the hospital's door as she was making her way back home. In West Pokot, a father was forced to look at his son as he writhed in pain at the Kapinguria Hospital. Bernard Chetukei had been taken to hospital with a broken leg. What aggravated the pain even more is the fact that he lacked funds to transfer Chekutei to a private hospital. Attendants in West Pokot opted to remain at home rather than dot the streets. The fate of some 22 babies born prematurely hangs in the balance due to lack of specialized care after doctors and nurses at the Kitui General Hospital joined the nationwide strike. The incubated babies have been left under the care of subordinate staff. The beds are empty. With the biggest public hospitals on strikes, the once crowded courtyards of desperate patients have become ghost towns. The health ministry, struggling to clear its name over corruption, now have one more malady to add: a dire public health crisis. Ngoiri, NTV.